Hi, Dr. Jessie here with Chiro for Moms. We are talking with Dr. Pam Jordi with Clinic Sofia. I'm going to let her introduce herself, talk about who she is, what she is, her passions behind obstetrics. And without further ado, here she is.
Hi, I'm Dr. Pam Jordi. I'm with Clinic Sofia. I am born and raised in Minnesota, and now I'm raising my own two rambunctious boys, and we are loving it. So keeps us busy, and a dog.
And a dog. She actually said before we got going that there might be some interruption along the way. We
Okay.
we're going to just very briefly, very topically talk about ECVs because a lot of the patients on our side do not understand or know what it is. They don't know if it's invasive or non-invasive. They don't know what the doctor is actually doing. They don't even know what it is for when I bring it to their attention. So I thought we would just very broadly talk about what an ECV is with Dr. Pam. And so I'm going to let you kind of take it from there, and I'll just interject with questions if need be.
Okay. Sorry, this is terrible.
This is so
Get
motherhood.
the dog outside. She's being a pain. And it's just not going to work. So, okay. What an ECV is. Okay, this is dog. Cassie. Cassie. Okay. We'll have to link in. I'm gonna put her in the kennel.
Great.
Come
I love everything about that. I met Pam, I don't even know how long ago, but actually, well, Dr. Jordi, I shouldn't call you Pam out here. Dr. Jordi delivered one of our doctor's babies, like, I don't even know, 4 years ago, 5 years ago. Most of, well, do you remember how long ago that was? I think it was at the height of COVID, maybe. I don't know.
I think it was 3 years ago.
But she literally came back to the office on like, I don't even know, post maternity, or no, maybe she was just visiting the office and she's like, well, Dr. Jordi delivered my baby. I was like, that's amazing. And it was beautiful. It went really well.
It was beautiful.
It was,
It
yeah, it
really
was
was.
awesome delivery. Very fun. You do have a lot of those. Dr.
Okay.
Oh, go ahead. Sorry. I was going to keep talking.
No, the dog's in the kennel now.
Awesome. Real life.
Okay.
So a lot of our patients on this end do not understand what an ECV is. They, I mean, truly don't even know what it stands for. They don't know what the doctor is doing. They don't know what it involves. And so I want Dr. Jordi to really dive into what it is. And I mean, it'll be kind of a broad topic because we don't have a lot of time here today, but to give you some insight into what an ECV actually is.
Yeah. So it is not a very common procedure. It is external cephalic version, ECV, is the acronym for that. And that is if the rare chance your baby is still breech by the time you're about 36 to 37 weeks.
Mhm.
And we truly wait until 37 weeks because that's the point when you are term in your pregnancy. Okay. And before that, there's still likelihood that that baby will turn to being head down. So we truly don't make too much notice of which direction the baby is facing, up or down, breech or cephalic or head down, until about 36 to 37 weeks. At that point, if baby is breech, so butt down, head up, that is when we will talk about your options. One option could be to wait a little longer. Another option would be to actually do this external cephalic version or ECV. And then the last option would be to just opt for a cesarean section because since a breech vaginal delivery is typically very risky. So for the families that choose to do an ECV, it is a procedure. So it's actually, we have this done in the hospital because of the associated risks that could happen, though oftentimes that those risks don't occur. We just always are watching out for them. So what we would do then is the day of your scheduled procedure, we'd meet you at the hospital and we would have an ultrasound. We check on baby. We would see what position baby's in. We're taking into consideration where the placenta is located, how much fluid is around the baby, so that we can kind of determine the best route to go to get baby to flip over and get to be head down. And so the actual procedure is your physician will put hands on your abdomen with significant amount of pressure to physically get that baby to basically somersault around and get to go from head up to head down. And during this process, we have the ultrasound to check on positioning. And we're also paying attention to baby's well-being with those monitors on your abdomen to watch the fetal heart rate, and then ultrasound as well to watch the baby. So this could take anywhere from 15 to 30 minutes to attempt to get baby to rotate around. We can try a forward somersault or a backward somersault, and sometimes it works. And then sometimes it doesn't. So it's actually close to about 50-50, but it is a great opportunity that if baby does flip head down, then you'd still have that option to be able to have a vaginal delivery.
And then what's the latest you would do an ECV? Because you said you'll do it as early as like the 37 mark. What is the latest you would do it for somebody, say, you know, they were head down most of their pregnancy, and then all of a sudden at 39 or 40, would you still be able to perform an ECV, or would you not in that case?
I think that's still a discussion with their physician, but personally, I would definitely leave it as an option. Okay. It may, you know, depending on that situation, you know, for a baby that flipped that late in the pregnancy, the chances of being able to flip again are decent, but baby's bigger. So a bigger baby tends to be a little bit harder.
That makes total sense. As far as, because something people always ask me is if it's invasive, and I know I've sent you messages before asking specifically, like, in a certain scenario, is there ever a chance where you would actually be positioning your hands in a certain way where you're kind of like contacting baby in any way where it's not internal, but it's, I don't know, is there a better way for me to say this? Would it ever?
I understand what you're asking.
I don't like the word invasive. I do not.
Yeah.
Like
so,
but like where you're, go ahead.
Invasive as in like making any incisions or anything like that. It's not.
Right.
But
okay.
It is a procedure. So yeah, it is a procedure where, you know, because of the risks, and your physician will talk to you specifically about those. You know, we do it in a hospital setting. You have an IV in place in that case. And in order to move baby, there's a lot of pressure in the abdomen. And in the very rare instance, sometimes baby's breech, the bottom, is deep in the pelvis, and we need to sometimes get that up out of the pelvis. Sometimes that can be done from the abdomen near your pubic bone. There are rare times where we do need to do a vaginal exam in order to help push that breech up out of the pelvis to help baby flip around and have a little more space and not be so stuck in the pelvis. But as far as those ECVs go, that is more rare.
Okay, that's super helpful. That's a lot. That's plenty. That's more than most people ever ask or, you know, want to know. And if they want to know more, I obviously would recommend that they go in to actually see you and have this conversation. But that was super helpful because, again, these are the questions we get in our office, especially if somebody is coming in with concerns of having a breech baby. If we're doing, you know, the Webster technique and we're really getting into the getting those questions. And so it's really helpful to have something like this. So thank you. You're amazing. Good luck with pup and your kiddos and being home today, and enjoy the sun because it's beautiful. So grateful for your time. We'll see you later.
Thank you. So good to talk to you.